We run an organisation of just over 250 people that deliver healthcare advice and services to New Zealanders. Have around 2,000 contacts a day across 7 digital channels, so that's telephone, text, web chat, websites and a few others including Facebook. And our job is to really have clinicians that are providing advice over those digital channels to New Zealanders. We're actually all about integrating, both integrating across clinical teams, whether that's clinical teams in the ambulance clinical hubs, the National Poison Centre, our nursing team, our mental health team, or whether it's between our service and the services in the health sector. It's the opportunity, it's a world first, creating an integrated national telehealth service like that.
As a healthcare organisation, it's very high quality and has great standards of service and customer experience for our callers. The very special thing about it is that it's open 24 hours a day, 7 days a week. Whatever number they ring, they will get that right, the right care at the right time.
In around 2014, an opportunity came up to create the National Telehealth Service. Over a very short period of time, in fact 15 weeks, we went from 20 staff to over 250.
When all the phone lines were being run by separate organisations with nobody talking to each other, there was a real disconnect for the caller, but that's not there now.
Spark was a critical part of that change and of that scaling of the infrastructure.
Their requirements of us was to provide a range of services so that clinical nurses, triage nurses, could work either from a physical location or a virtual location anywhere around the countryside. So they are a virtual team.
Homecare Medical, we just don't want to be spending time and money maintaining resources and systems on site. So it really was a no-brainer that we went down a cloud route. However, we had to balance the cloud against the need to maintain patient security and privacy. So how we do that is we've got a cloud that's been built by Spark that is kept secure within the connected health environment. What that also means is, as an organisation, we haven't got loads of technology people running around looking after servers and things. We're not qualified to do that kind of work. What we're qualified to do is use technology to deliver great clinical care. One of the things for us at Homecare Medical and the National Telehealth Service is really working with government and other parts of the health sector to understand what are the problems out there that we can solve. You know, how do we respond over technology with a team of clinicians to solve a problem in society and make a really big difference in that? And that's what Spark bring for us. They bring scale, they bring size, they bring expertise that really help us to achieve that outcome. As an organisation, currently we have 7 channels that people can connect with us, but we're in conversations with some of the large international technology players about how we change that. Over the last 12 months, we've introduced deep integrations with things like Facebook. You know, I'm challenging the team about how's a nurse in 5 years' time going to be delivering triage over apps. How are we going to be using services like Instagram? You know, what's an Instagram triage look like? So that's some of the stuff that we're starting to think up with Spark to really understand how New Zealanders want to receive health information and interact with their health system.